In his final State of the State address this week, Ohio Governor Mike DeWine touted the drop in accidental drug overdoses during his tenure.
For the third year in a row, unintentional drug overdoses have decreased, this time by an astounding 34%.
And we have reported here heavily on 21 News about the fight against the opioid epidemic in the Valley, especially in Trumbull County. Last night, Warren City Council approved a new opioid settlement between the city and Associated Pharmacies Incorporated for an undisclosed amount of money. Councilwoman Helen Rucker tells 21 News it will add to the $600,000 the city has settled already so far with other companies. So what does the strategy for keeping the overdose deaths at bay look like this year? Trumbull Mental Health and Recovery Board Associate Director Lauren Thorpe, she's joining me here now. So Lauren, the governor pointed to the lower accidental overdose deaths as a top accomplishment, but what does the strategy still look like this year and moving forward on the ground in Trumbull County for keeping those drugs out of the hands of users?
Yeah, hi, Lindsay. Thanks for having me this evening. And thanks for asking, because I think the governor was right, definitely. Being able to reduce those drug overdoses over the past few years like we have is a huge accomplishment. That is not only to people working with me, but to everyone in our community. And what that tells us is what we've been working on works. So now is not the time to quit. Now is not the time to try a whole new strategy. We're going to keep doing a lot of what we've been doing, helping get Narcan out into the community, host events where clinicians have the opportunity to hear from professionals in the field and learn what the latest techniques are for treatment, what the latest drugs are out there, just making sure that our clinicians are well educated and able to work with this population and help these numbers continue to decrease. We'll have our annual recovery rally in September where we can showcase recovery in our community and help others build hope and see that recovery can happen. Yeah. But in the meantime, we're going to continue to look at, as this trend changes, what are things that we can do to address new trends as they come up.
And let's talk about, some of the things that you work on. You're with also ASAP. So there's agencies that come together. For folks who may not know, you meet often, and talk about how helpful those resources have been in terms of the synergy you've created within them.
Oh, our community partners are wonderful. And I would say my favorite time of ASAP and our ASAP meetings is when I first walk in the morning. And like I said, our coalition meets 10 times a year. We meet once a month, except for in July and December. And when I walk in that room and just hear the conversations of all of the different agencies and people in that room, and then the laughter and joy. And I just think about how all of these people are coming together for a common issue, but they come from such different backgrounds. People in law enforcement have a very different experience with people with an addiction than a family member does, or say a treatment professional does. And then we have our health department that is out there doing great things, looking at overdose numbers, looking at places of overdoses, and going to those places to help deliver Narcan. And they've really opened the door to some new partnerships and new ways of getting Narcan into our community. We certainly could not do any of the work that we do with the coalition without all of our community partners. And I'm just really proud when I see them all come together, come from their different backgrounds, but put that all together for a common goal.
And how significant have the state resources been in helping and aid this fight? The governor says he's really proud of this. Has the state given as much as you think they can or should?
I think the state has given a lot. Certainly, we would not be able to get the amount of Narcan into our community without the support of the state. Most of what we've been able to get has been at either very low cost or no cost. And if we had to come up with the resources for that or be able to pay for that, it's very expensive. Yeah. So it would not be nearly as available as it is to people. And we know it's Narcan that's saving lives. We know that. When we see that we have a big push in getting Narcan out in the streets, we see a decrease in overdoses following soon after that.
Thank you so much for breaking all that down. I know that you also work in the school districts to keep these drugs out of the hands of kids. So thank you so much for taking the time to give us this update.
Thank you.